has increased and led to increased spending of time on different screens across all ages. So increased screen time usage and decreased outdoor activity amongst adolescents is found to be associated with high myopia. Vitamin D is considered to be a biomarker of outdoor activity. So early onset myopia in childhood leads to high myopia in adulthood. So it becomes very important to control its progression from an early age. Conventional playtime, both indoor and outdoor activities, have been replaced by the time spent on screens. It has been shown in studies that odds of myopia decreased by around 2% for every additional hour of outdoor activity per week. So our aim was to estimate screen-based media use, that is SPM use, and vitamin D levels in these adolescents in northern India, and to estimate the prevalence of dry eye syndrome and pattern of outdoor activity amongst adolescents. Also to study the association of screen-based media, vitamin D levels, dry eye disease, and outdoor activity with myopia. So a cross-sectional pilot study was carried out amongst 96 participants at the Department of Ophthalmology in PGI Chandigarh. It was done for a period of 2 months amongst adolescents aged 10 to 19 years. Participants with a mean spherical equivalent of less than equal to 0.5 diopters were included, and participants with a history of cataract surgery, corneal graft surgery, laser eye surgery, or any trauma were excluded. Refraction was measured using table-mounted autographs after cycloplegia, after instilling cyclopentalate 1%. So the mean spherical equivalent of less than equal to -6 was considered as myopia, and greater than -6 was considered as high myopia, and the best eye was used for the analysis. A pre-tested questionnaire including standard patient evaluation for eye dryness, that is a speed questionnaire, was used. Screen-based media use was referred to as use of television, computer, or video games. Indices were developed for screen-based media usage and dry eye. SBM score was categorized in 4 categories, that is category 1 less than 2 hours, category 2 2 to 3 hours, category 3 3 to 4.5 hours, and category 4 as more than 4.5 hours. And the speed score was categorized in 3 categories. 0 to 4 was mild, 5 to 7 was moderate, and a score of greater than 8 or above was severe. And the cutoff for adequate physical activity was taken as 1 hour. Vitamin D deficiency was defined as level less than 20 nanogram per milliliter, insufficient 20 to 29, and sufficient more than equal to 30. Statistical analysis, descriptive and inferential statistics were used for the analysis. Univariate and bivariate analysis was done. Pearson correlation coefficients were calculated with different score and biomarkers, and regression analysis were done. The results included mean age of the myopic adolescents was around 14 years. There were 48 male and 48 female adolescents. The mean manifest spherical equivalent of the study population was -2.84, and the mean amongst the boys was -3.06, and amongst the girls was -2.62. And the mean time spent on near work was 6.8 hours per day amongst the study participants, and on an average boys spent 7.1 hours and girls spent 6.62 hours. Around 6% of the adolescents had high myopia, and 45% of them had a history of parental myopia. And the mean screen-based media score, that is the time spent on television, mobile, tablets, desktop, laptop, was around 2.4 hours. The SBM score for entertainment was 2 hours approximately, and for education was just 1 hour. The majority of the adolescents, that is 75% of the adolescents, were using applications like WhatsApp, Facebook, and other games. The mean SBM score amongst boys was 2.5 hours, and amongst females was 2.2 hours. And this on speed score of dry eye, around 82% had mild dry eye, 15% had moderate, and 4% had severe dry eye. Around 45% of the adolescents were physically active for less than 1 hour per day, whereas boys played outdoors for around 1.29 hours per day, and girls played outdoors for around 0.9 hours per day. So this was a screen-based media use across the gender. The girls were using were mostly in the category of less than 2 hours, and the boys were having significant screen-based media use. Television was the most common, that is, it was in use in around 91.6% of the patients. So the mean serum vitamin D level were 18, it was deficient. A total of 91.5% of the adolescents were either deficient or insufficient in vitamin D, whereas 62.5% and 28% were vitamin D insufficient. Myopia was found to be negatively associated with vitamin D levels. That is, more the vitamin D level, less the myopia. Physical activity was negatively correlated with myopia. That is, more the physical activity, less the myopia. On regression analysis, high myopia was found to be 7.6 times more likely to be associated with moderate and severe dry eye syndrome. So high myopia was
Conclude.
Yes, increase in outdoor activity was found to be correlated with decrease in myopia. So we conclude that adolescents are spending a lot of time on screens and less time on physical activities, which leads to deficient vitamin D. Parents and school teachers should be educated and counseled, and screen-based media use should be decreased. Scolding, setting rules, and making a timetable should be done. Parents are the best role models, and increasing outdoor activity should be done to prevent myopia. Thank you.
Thank you. Every speaker should restrict it to the time. Otherwise, there will be negative working. Please. Ma'am, you have done a good study, but vitamin A is a more common factor for the eye problems. Have you satisfied before that key patient socio-economical condition or vitamin A level and
Sir, we haven't, you are very right, but we haven't done the vitamin A status. We just correlated with the vitamin D activity
I think
level.
that is
We can do that
first.
also.
Anyhow,
Yes.
good. Okay.
Thank you, sir.